Today we're going to talk a little bit about recheck exams, which unfortunately have a tendency to make people groan. Hi, I'm Dr. Paige Wallace, the Urgent Care Coordinator here at Tier 1 Veterinary Medical Center. So here's the deal with rechecks. One of the most common messages I find on my board is clients requesting a refill of some medication, or client wants to know what the next steps are. This is where a recheck exam comes in. It's not about being a barrier between you and a medication or trying to milk it out for more time, higher bills. It's irresponsible in a lot of cases to just send home an antibiotic a month later, even though you haven't seen the pet and it's still coughing. Why is it still coughing? It should have been treated appropriately the first time. Is something more severe going on? A lot of the medications that we use can actually cause more harm than help. In the case of antibiotics, are we creating resistance? Are we targeting the appropriate infection? That's where stuff like cultures, recheck blood work, recheck x-rays comes in. If the problem's getting worse, then the antibiotic we gave may not be the answer, and we may need to identify the pathogen we're treating. Yes, that can be frustrating because it takes more workups, more exams, more money, more tests, but the aim is to try to come up with the shortest path to help your pet as best we can. When it comes to medications like anti-inflammatories, those are not benign medications. We don't just send them home willy-nilly, especially not in large quantities, without regular follow-ups to make sure that we are not harming your pet's liver and kidneys, because a lot of them do. You know, people, just like pets, have arthritis. A lot of us use ibuprofen all the time, but if you're taking it every single day, multiple times a day, or your pet is, eventually that starts to wear. So we need to make sure that there's no indication to switch to a different medication that might be a little more sparing, although a little more expensive, and not cause organ dysfunction on top of arthritis. Another consideration we have for rechecks: when's the last time I saw your pet? If it's 15 months, sorry, I can't help you with anything. It's actually not legal. There's a relationship that has to be formed and maintained. It's called a valid veterinary client-patient relationship. I have to have seen your pet within at least 1 calendar year and have enough knowledge of you and your animal and a maintained relationship to be able to understand the issue I'm treating and the meds I'm prescribing. Not to mention, what other meds are your pet on? If I send home an anti-inflammatory and they're on a steroid or another anti-inflammatory, that can cause major harm. So it's important to maintain that relationship, to do follow-ups, to let me get my hands on your animal and feel, are there indications of something wrong that we may need to address? Rechecks can be tiresome, but we're already addressing the problem. It tends to be less expensive, less time intensive than the initial exam because we already have that baseline of what the problem was. Okay, where are we at now and where do we need to go? If I don't need to see your pet again, I will let you know. I'm not interested in wasting your time or money or my time following up when it's not necessary. So if a follow-up's recommended, take our word for it, grin and bear it, bring your pet in and hopefully just get the thumbs up you're in the clear, or slight modifications that may be able to derail a train headed off the track. For more information on why your vet may recommend a recheck, click the link in the description below, or like and subscribe for more information and tips and tricks on caring for your pet.